Do you know the reason why your long self-treated infection still persists? This is because our reproductive system is prone to bacterial infections, yeast infections, and then some parasitic infections. Yes, and so if you have not really figured out what exactly is causing your infections, you may be taking the wrong drugs for your wrong self-diagnosis. Yes, that is why you are advised to abstain from self-medication. This is the Lab Doctors channel, and I am here to educate you on your health. So I will encourage you to subscribe to this channel, like, share, comment. If you have any topic that you want us to talk about, please do not hesitate to put it on the comment section. Lastly, please kindly share the link. Share the link to your friend, share it on your Facebook timeline, and let's do this together. To our topic for today: UTI, urinary tract infection. So, UTI infection is any bacterial infection that affects the urinary tract. So, when you talk of the urinary tract, it comprises of the kidney, the bladder, the urethra, and then the ureters. Okay, let's take their function one after the other. So, kidney, it filters waste products from the blood to make urine. And then the ureters, they are long-term tube that carries urine from the kidney to the bladder. The bladder stores urine. Yes. And then the urethra. The urethra is a passage for urine from the bladder to out of the body. So UTI is specifically bacterial infection. When you're talking about UTI, then we are looking at bacterial infection. Yeast infection is not part of UTI. Please let's take note. So the most common site for UTI in the urinary system is the bladder. That is the place that stores urine. So UTI in the bladder is called cystitis, and then UTI in the urethra is called urethritis, and UTI in the kidney is called pyelonephritis. Women are of higher risk in terms of UTI than men. This is because of their urethral opening that is near to their vagina as well as their anus. So bacteria from both sides, from their anus and then vagina, is able to travel to enter their urinary system and then cause infection. UTI is treatable. Yes, it is very treatable. So let's look at laboratory diagnosis of UTI. One is urinalysis. So in urinalysis, leukocyte is considered, nitrate is considered, and in microscopy within the urinalysis, we look at pus cells, bacteria, and then clue cells. Urine culture and then sensitivity is another way of diagnosing UTI in the laboratory, specifically medical laboratory. So let's look at people of higher risk of UTI. Pregnant women are of higher risk of UTI. We have sexually active men and then women, diabetic patients, patient on catheter, patient with kidney stones, and then menopause or menopausal women. Let's look at signs and then symptoms of UTI. We have burning sensation, most especially during urination. We have abdominal pain, we have fever, we have chills, and cloudy urine or blood in urine. These are symptoms of UTI. Let's look at the way UTI can be treated. It can be treated with antibiotics. And so, if you're having an infection and you do not know what exactly is causing your infection, whether it's bacteria, whether it's fungi, or whether it's parasitic, and then you go in for any of these, whether, let's say, you are having yeast infections, no, both yeast infection, bacteria infection, and then parasitic infection have similar signs and then symptoms. And so, if you are actually suffering from bacteria infection and then you go in for antifungi, I bet you it's not going to work. The same way, if you are suffering from yeast infection and then you go in for antibacteria, it's not going to work. So please and please again, let us always see our doctors to know what exact tests to do to come out with proper diagnosis, to be able to get the right drug or right medication to treat our infections. Just as I always say, your health is very vital to me, to your family, to the nation, and to the whole wide world at large. Stay safe, stay healthy till we meet again.